Hello, Dr. Cadena again. Today we're demonstrating removal of a contraception device called Nexplanon. So it's an implantable device that secretes a hormone called progesterone into the body and prevents pregnancy, basically. It's not one of my favorites. I see that it affects things from weight to mood, but the number one that women don't like is kind of weight and mood, I guess, both of those. But I see a lot of irregular cycle control, irregular bleeding, so I'm not a real big fan of it. So I tend not to put these in, but we do remove them quite often. This contraceptive device is in the family of like the Depo-Provera shot. That again, I don't like that one because it has associated with a lot of weight gain. It thins the bone to a certain extent, and it just basically puts someone similar to being in menopause, kind of. So those I don't like. I do like the Mirena IUD. It's a progesterone only device that goes in the uterus, and most people quit having periods. It has local effects, no weight gain or anything like that, so I do like that one. The other contraceptions with estrogen and progesterone being pill patch or a ring, I like those. It has minimal side effects, but today we're removing what's called Nexplanon. So we've numbed up the area with just a little local anesthesia. We made a real tiny incision. It's probably about 3 millimeters here. You can see it, real tiny. The capsule is kind of buried under the skin. So now what we're going to do is we're going to try to locate it and remove it. So in the old days, we used a device called Norplant, which was 6 little capsules. And this is just one, so we used to have to hunt down 6 of these. So when I push on the back part, you can see that the tip is kind of bulging up right here. Kind of hard to see, but you can actually feel the tip right there. So first thing we're going to do is just going to kind of try to break up a little bit of the scar tissue. If you have pain, let me know. So as we're doing this, we're just kind of feeling at the same time. And once we can kind of grab it and kind of bring it up, then it becomes a little bit easier to get to. But part of the trick is to break up the scar tissue that is kind of surrounding the capsule. So the body tends to make a little scar tissue. And there's the tip. You can see it's just kind of a white tip. So we have it where we want it. And now it's just continuing to kind of free up that scar tissue. So once you grab it, once you've identified it, then you can use a little bit of a sharp point to start working the tissue away from the actual implant. So you can see that the capsule is white. And so there's the capsule, and it's about to come out. So as you gently pull on it, then you see that there's the capsule. So we're done. In the old days, we had to chase 6 of these down. So it's gotten a little bit easier to do. But that's just showing you how pretty simple. I guess some people have problems removing these. They're not supposed to be placed real deep in the tissue, and I've never had the experience of having a tough time removing it, but sometimes I guess people have to order an ultrasound to try to identify where it is, but most of the time you can feel it pretty easily and just make a little incision and remove it like that. So that's showing you how we remove the Nexplanon. Thanks for watching.